Cancer is on the rise, affecting millions of lives every year. But here's the real question: if your body was trying to warn you, would you recognize the signs? Most people don't, and that's what makes early detection so critical. Some cancers, like pancreatic or brain cancer, develop silently, only showing symptoms when it's already too late. But catching it early? That can make all the difference. Now, I get it, every little ache or symptom can feel alarming when you start searching online. But today, we're cutting through the fear and misinformation. We're bringing you scientifically backed warning signs that could help you or someone you love detect cancer when it's still treatable. Your health is your greatest asset, and being aware could save your life. So stay with us, pay close attention, and if you find this valuable, subscribe for more essential health insights. Number 1. Persistent fever. A fever is usually your body's natural way of fighting off an infection, but what if it lingers for more than 2 weeks with no clear cause? This could be your immune system sending a serious warning sign, one that might point to blood cancers like leukemia or lymphoma. Unlike common fevers that come and go with colds or the flu, cancer-related fevers often follow a pattern, rising and falling at regular intervals, known as cyclic fever. This happens because blood cancers affect white blood cells, disrupting your body's ability to fight infections properly. You may also notice night sweats, where you wake up drenched, even in a cool room, or unexplained weight loss without dieting. Another key red flag? A fever that keeps returning for no obvious reason, especially if it's accompanied by fatigue, pale skin, or unexplained bruising, all signs that your blood cell production might be compromised. While persistent fever doesn't always mean cancer, it's a symptom you shouldn't ignore. If you've been dealing with ongoing fevers that don't seem to resolve, it's time to check in with your doctor. Catching something early can make all the difference when it comes to your health and your future. Number 2. Jaundice, yellowing of skin and eyes. Have you ever noticed a yellow tint in your skin or the whites of your eyes? While jaundice is often associated with liver issues, it can also be an early warning sign of pancreatic, liver, or bile duct cancer. This happens when a tumor blocks the bile duct, preventing bilirubin, a yellow pigment produced by the liver, from being properly filtered out of your body. As a result, bilirubin builds up in the bloodstream, causing that yellow discoloration. But jaundice doesn't just stop at skin changes. It's often accompanied by dark urine, pale or clay-colored stools, persistent upper abdominal pain, and even unexplained itching. The itching occurs because excess bile salts accumulate in the skin, creating discomfort that doesn't go away with scratching. Now, jaundice can be caused by other conditions, including hepatitis, gallstones, and liver cirrhosis, but here's the key: if jaundice appears suddenly, especially with abdominal pain, don't ignore it. Pancreatic and liver cancers are often silent until the later stages, making early symptoms like jaundice critical warning signs. If you or someone you know experiences these symptoms, consult a doctor immediately. Early detection could make all the difference in treatment and survival. Number 3. Unexplained pain. Pain is your body's way of telling you something isn't right. Most of the time, pain has an obvious cause, an injury, overuse, or a temporary condition. But when pain lingers for more than 4 weeks without a clear reason, it could be a hidden warning sign of cancer. Unlike everyday aches, cancer-related pain doesn't follow the usual rules. It often worsens at night, doesn't improve with over-the-counter medication, and may be accompanied by unexplained swelling or lumps. The location of the pain can sometimes hint at the type of cancer involved. Persistent abdominal pain may indicate pancreatic, liver, or stomach cancer, while chronic breast pain in women could be linked to breast cancer. In men, scrotal pain should never be ignored, as it might be an early sign of testicular cancer. Meanwhile, Chronic back pain that refuses to go away could be due to spine tumors or cancers that have spread to the bones. We all experience pain from time to time, but persistent, unexplained pain that doesn't respond to treatment deserves medical attention. If you've been dealing with constant discomfort that won't go away, don't dismiss it, talk to your doctor. Early detection can be life-saving. Number 4. Dark streaks under nails, a warning sign of subungual melanoma. Have you ever noticed a dark streak under your fingernail or toenail that appeared out of nowhere? If you haven't had an injury, and the streak continues to grow, change, or darken, it could be a sign of subungual melanoma, a rare but serious form of skin cancer that develops beneath the nail bed. Unlike a harmless bruise that fades over time, this type of melanoma persists, spreads, and may cause changes in the texture of the nail. One of the biggest warning signs is Hutchinson's sign, where the dark pigmentation extends beyond the nail and onto the surrounding skin. Other red flags include nail splitting, bleeding, or sudden streaks that appear on multiple nails. While many people mistake these streaks for fungal infections or simple discoloration, ignoring them can be dangerous. It's important to note that subungual melanoma is often diagnosed late because people assume it's nothing serious. If you notice an unexplained dark line under your nail, especially if it gets wider or changes shape, consult a doctor or dermatologist as soon as possible. Catching it early could make all the difference in successful treatment. Number 5. Bone pain, a hidden warning sign of cancer. Pain is something we all experience, but when it lingers for weeks, worsens at night, and has no clear cause, it's time to take a closer look. Persistent bone pain, especially if it becomes deeper, more intense, and progressively worse, could be a sign of bone cancer or cancer that has spread to the bones, metastatic cancer. Unlike temporary aches from physical activity or minor injuries, cancer-related bone pain doesn't go away with rest or common pain relievers. This happens because cancer weakens the bone structure, making them brittle and more susceptible to damage. Over time, this can lead to swelling near the joints, frequent fractures, and increasing discomfort that doesn't improve. Some people describe it as a deep, aching pain that worsens at night or during inactivity, unlike typical soreness from overuse. While bone pain can have many causes, such as arthritis, osteoporosis, or injuries, it should never be ignored if it's persistent, unexplained, or worsening. If you notice swelling, tenderness, or unexpected fractures, don't dismiss it. Early detection of bone cancer can dramatically improve treatment success, so if your pain doesn't go away, consult a doctor as soon as possible. Your body might be trying to tell you something important. Number 6. Eye pain and vision changes. Could it be a sign of ocular melanoma? Your eyes can tell you a lot about your health, and sometimes they warn you about something serious. If you've been experiencing blurred vision, floating dark spots, or unexplained flashes of light, it might not just be eye strain, it could be a sign of ocular melanoma, a rare but dangerous form of eye cancer. This type of cancer develops in the pigment-producing cells of the eye and often goes unnoticed until symptoms become more severe. Some of the biggest red flags include a dark spot on the iris, the colored part of your eye, persistent eye irritation that isn't related to allergies, and sudden vision loss. Unlike common vision issues that improve with new glasses or eye drops, these symptoms tend to worsen over time. Certain factors can increase your risk, including fair skin, light-colored eyes, and prolonged sun exposure. Since ocular melanoma can be aggressive, early detection is crucial. If you've noticed any of these warning signs, especially a growing dark spot in your eye or vision changes that won't go away, don't wait. Schedule an eye exam with a specialist as soon as possible. Your vision and your health depend on it. Number 7. Excessive bruising, a silent warning sign of blood cancer. We all get bruises from time to time, but when you start noticing frequent bruises in unusual places, like your arms, back, or legs, without any clear reason, it could be more than just clumsiness. Excessive, unexplained bruising is often an early warning sign of leukemia or other blood cancers. This happens because leukemia affects the production of platelets, the blood cells responsible for clotting. When platelet levels drop, your body can't stop bleeding as efficiently, making even minor bumps lead to large bruises. In addition to bruising, other key warning signs include frequent nosebleeds, bleeding gums, and tiny red or purple dots on the skin known as petechiae, which occur due to small blood vessel leaks under the skin. While bruising can have many causes, including medications or vitamin deficiencies, persistent, unexplained bruises should never be ignored. If you're also feeling fatigued, pale, or experiencing other unusual bleeding, it's time to see a doctor. Your blood tells a story about your health. Pay attention to the signs. Early detection can make a life-changing difference in successful treatment. Number 8. Persistent cough or hoarseness, more than just a cold? A cough is usually nothing to worry about. It's a common symptom of colds, allergies, or even dry air. But when a cough lingers for more than 2 weeks, especially if it doesn't improve with treatment, it could be a warning sign of lung, throat, or thyroid cancer. Unlike a temporary cough from a respiratory infection, cancer-related coughing is persistent, dry, and progressively worsens over time. One of the biggest red flags is coughing up blood or producing blood-tinged mucus, which could indicate lung cancer. Another key symptom is hoarseness or voice changes. If your voice suddenly sounds raspier, weaker, or deeper and doesn't return to normal, it could be linked to throat or thyroid cancer. Additionally, difficulty swallowing, dysphagia, or feeling like something is stuck in your throat might suggest an issue in the esophagus or throat. Many people ignore a chronic cough, assuming it's just lingering from a past cold. But if it doesn't go away, gets worse, or comes with any of these alarming symptoms, it's essential to see a doctor. Catching cancer early can make all the difference in treatment success. Don't wait until it's too late. Number 9. Blood in urine or stool, a silent but serious warning sign. Seeing blood in your urine or stool can be alarming, and for good reason. It's not something you should ignore. While minor cases could be due to hemorrhoids, infections, or kidney stones, persistent or unexplained bleeding can be an early warning sign of colon, bladder, or prostate cancer. If you notice blood in your stool, it may appear as bright red streaks or black, tarry stools, which could indicate colon cancer or rectal cancer. These cancers often begin with subtle digestive issues, so if you're also experiencing changes in bowel habits, persistent diarrhea, constipation, or abdominal discomfort, it's time to take it seriously. On the other hand, bloody urine, hematuria, can be a sign of bladder or prostate cancer. It may appear as pink, red, or dark brown urine, sometimes without any pain. However, in some cases, it's accompanied by pain during urination, frequent urges to go, or difficulty emptying the bladder, all of which could signal a serious underlying issue. If you experience unexplained weight loss, fatigue, or any of these symptoms, don't wait, schedule a medical checkup. Catching cancer early increases the chances of successful treatment, so listen to your body and act quickly. Number 10. Mouth sores that don't heal, a sign of oral cancer? Most mouth sores, like canker sores or minor cuts, heal within a week or 2. But if you have a sore that doesn't heal after 2 weeks, it could be a warning sign of oral cancer. Many people dismiss these sores as minor irritations, but when they persist, it's time to take a closer look. One of the biggest red flags is the presence of white or red patches inside the mouth, known as leukoplakia. These patches don't wipe away and can indicate abnormal cell growth. Difficulty swallowing, a persistent lump in the mouth or throat, or chronic throat pain are also concerning symptoms that require immediate medical attention. Certain lifestyle factors significantly increase the risk, especially smoking and heavy alcohol consumption. The combination of tobacco and alcohol creates a high-risk environment for cancerous cell development in the mouth, gums, and throat. If you notice a mouth sore, lump, or discolored patch that lingers beyond 2 weeks, don't ignore it. Early detection of oral cancer dramatically improves treatment outcomes. If something doesn't seem right, schedule a checkup with a dentist or doctor as soon as possible. Number 11. Chronic heartburn, more than just acid reflux? Heartburn is something many people experience occasionally, especially after a big meal or spicy food. But when acid reflux becomes a daily struggle, it might be a sign of something far more serious: esophageal cancer. Persistent heartburn, also known as gastroesophageal reflux disease, GERD, can gradually damage the lining of the esophagus, increasing the risk of Barrett's esophagus, a precancerous condition that can develop into cancer over time. One of the biggest warning signs is difficulty swallowing, dysphagia, feeling like food is getting stuck in your throat or chest. Another red flag is acid reflux that doesn't improve with lifestyle changes or over-the-counter medications. Over time, chronic inflammation from stomach acid can lead to cellular changes in the esophageal lining, making early detection crucial. If you've been relying on antacids for weeks without relief or experiencing trouble swallowing, unexplained weight loss, or frequent throat irritation, it's time to consult a doctor. Ignoring long-term acid reflux can have serious consequences, so don't wait until symptoms worsen. Early intervention could make all the difference in preventing esophageal cancer and protecting your digestive health. Number 12. Changes in urinary or bowel habits, a warning sign you shouldn't ignore. Your digestive and urinary systems are excellent indicators of overall health, so when something feels off, your body might be trying to tell you something important. If you've noticed persistent diarrhea, constipation, or other unusual bowel habits that last for more than a few weeks, it could be an early warning sign of colon or stomach cancer. These cancers often develop silently, and small changes in digestion might be the first clue. One of the biggest red flags is blood in your stool, which may appear as bright red streaks or dark, tarry stools. Chronic bloating, excessive gas, and feeling like your bowels aren't fully emptying are also signs that shouldn't be ignored. Similarly, urinary changes, like frequent urination, pain when urinating, or difficulty emptying the bladder, could point to prostate or bladder cancer. While occasional digestive discomfort is normal, persistent, unexplained changes in bowel or urinary habits require medical attention. If you've been dealing with long-term bloating, blood in stool, or unusual constipation or diarrhea, it's time to check in with your doctor. Early detection can be life-saving, so don't wait until symptoms become severe. Number 13. Unexplained body rashes. Could it be a sign of leukemia? We often associate rashes and skin irritations with allergies, infections, or eczema, but in some cases, they can be a warning sign of leukemia, a type of blood cancer that affects the body's ability to produce healthy blood cells. When leukemia disrupts normal blood function, it can lead to unexplained rashes, bruising, and skin discoloration that don't go away. One of the most distinct signs of leukemia-related skin changes is petechiae, tiny, red or purple pinpoint spots that appear in clusters, usually on the legs, ankles, or under tight clothing. These occur because leukemia affects platelet production, making it harder for the blood to clot properly. Unlike regular rashes, petechiae don't fade or blanch when you press on them. Another key symptom is persistent itching without a clear cause, which may be due to an overactive immune response triggered by cancerous blood cells. While rashes can result from many conditions, if you develop an unexplained skin rash along with fatigue, bruising, or frequent infections, it's crucial to get checked by a doctor. Your skin might be signaling something far more serious. Don't ignore it. Early detection of leukemia can significantly improve treatment outcomes. Number 14. Persistent headache. Could it be a sign of a brain tumor? We all experience headaches from time to time. Stress, dehydration, or lack of sleep can easily bring one on. But when a headache lasts more than 2 weeks, doesn't improve with medication, and seems to worsen over time, it could be a warning sign of a brain tumor. Unlike regular headaches, tumor-related headaches often become more severe in the morning, worsen with movement or coughing, and may be accompanied by neurological symptoms. One of the biggest red flags is vision changes, such as blurred or double vision, unexplained dizziness, or difficulty focusing. Another alarming symptom is facial drooping or numbness, which could indicate a tumor pressing on nerves, controlling facial muscles. Some people also experience seizures, balance issues, or weakness in their limbs. While persistent headaches don't always mean cancer, if you're dealing with chronic head pain along with vision disturbances, weakness, or neurological symptoms, it's critical to seek medical attention. Catching a brain tumor early can make a huge difference in treatment options and outcomes, so don't ignore your body's warning signs. If your headache won't go away, get it checked. Number 15. Persistent fatigue. More than just feeling tired? Everyone feels exhausted from time to time, whether due to a lack of sleep, stress, or a busy schedule. But when fatigue becomes constant, overwhelming, and doesn't improve with rest, it could be a warning sign of something much more serious, like leukemia or colon cancer. Unlike normal tiredness, cancer-related fatigue is debilitating, persistent, and often accompanied by other symptoms. One of the biggest red flags is unexplained weakness, where even simple daily tasks feel exhausting. Some people may also experience confusion, dizziness, or difficulty concentrating, which can result from low oxygen levels in the blood due to cancer affecting red blood cell production. In cases of colon cancer, persistent fatigue may be caused by slow internal bleeding, leading to anemia. If you find yourself constantly drained, weak, or struggling to focus, despite getting enough rest, don't ignore it. Fatigue that lasts for weeks, with no clear cause, needs medical evaluation. If it's accompanied by unintentional weight loss, pale skin, or frequent infections, it's time to see a doctor. Early detection of leukemia or colon cancer can be life-saving, so listen to your body and take action. Cancer can be silent, but your body often gives you warning signs if you know what to look for. Catching these symptoms early can make the difference between early treatment and late-stage complications. If you've noticed any of these signs, persistent fatigue, unexplained pain, or changes in your body, don't ignore them. Talk to your doctor and get screened. Early detection saves lives. If this information was valuable, please share it with your loved ones. You never know who might need this knowledge. Help spread awareness, it could save someone's life. And if you want to stay informed about health and wellness, subscribe to our channel and hit the notification bell so you never miss an important update. Your health is your greatest asset, take care of it, and take action today.